So you said you found that there's one surgery that fixed a majority. What is that surgery?
So the name of the procedure that I typically use to correct a bunion is called the lapidus procedure, or what's called a lapidus bunionectomy or a fusion. Traditionally, like a patient will see their bunion kind of up at the big toe, but in reality, this first metatarsal bone here has splayed out, and so it's the bone in its entirety has lost alignment. And so even though we see the bump up by the big toe, the real origin, or what we call the apex or the cora of the deformity, is back here at the first tarsometatarsal joint, which is where we do our fusion. And so literally what we do is we take that joint down and we close that bone down like a door, and we make it basically straight. And then along doing that, we're able to realign the big toe and keep everything nice and stable. The other nice thing about this procedure is we've taken recurrence rates of bunion deformity from 30 to 40% or even higher down to less than 6%. And so to have that type of success and yield, correcting the deformity where it's supposed to be corrected using long established, principles of deformity correction, we're really seeing higher success rates.
And how long is that surgery?
That surgery on average for a typical surgeon is going to take somewhere between 60 and 90 minutes. The surgery, I prefer to keep my patients asleep for it, so they're under general anesthesia, 60 to 90 minutes, but it's outpatient surgery. My traditional post-op protocol now is, they go home and mobilize in a splint. I keep them off their leg for about 10 days just to allow a decrease in swelling. And then when I see them in the office to get their stitches out, I put them into a boot and I start physical therapy 10 days out after the surgery. And so with the advances in technology, optimizing and fine-tuning our techniques, we're really able to accelerate these patients' recoveries where they're getting back into normal shoes 8, 12 weeks after the surgery and starting to resume their normal daily life.